So I would be in the next 15 minutes or so, I'll be discussing about how the COVID pandemic had an impact on the fasting. Did it really make an impact on the decision for fasting in many of our patients, or and how it could have? I mean, what are the potential issues that crop up with the COVID pandemic during this period of fasting? So we know that Muslims across the world would 90% of the Muslims across the world with type 2 diabetes prefer to fast during the holy month of Ramadan, and majority of them, we have been seeing across different studies, we have been seeing that more than 94% of them fast for more than 15 days, and therefore it is clearly seen that right now, this is data from the Creed study, which showed the data in 2010. Now in 2020, we have of the 450 to 500 million people with diabetes, we have 150 million of them are from the Muslim community, and it is clearly that the problem of issues regarding fasting during Ramadan have to be discussed with them before the holy month of Ramadan itself, so that the fasting can be done without any problems. That is the major problems that we're looking at is hypoglycemia, hyperglycemia, and thrombotic events. And if you look at the COVID pandemic, the last 3 years, the Ramadan has been a challenge because of the presence of the COVID pandemic, particularly during the Ramadan of 2020. And we have data from the Dar survey, and which showed that it clearly, in spite of the challenge that was there with COVID, many of our diabetics did go ahead with the fasting. Now, COVID-19 pandemic started off in 2019, end of 2019, and as on today, there are 347 million people globally who have been affected by COVID pandemic, and there have been more than 5 million deaths because of the pandemic. And as we know that the major problem is because of the fact that the virus uses the ACE2 receptor to enter into the lung alveolar cells, the cardiac myocytes, vascular endothelium, and various other cell types, including the beta cells in the pancreas. And we see that diabetes is particularly aggravated because of the COVID infection. And particularly, we have clearly seen that there is those with underlying health issues, particularly those who are obese, those with cardiovascular disease, and those with type 1 diabetes or type 2 diabetes are the ones who tend to have a more severe disease, requiring intensive care requirement, and also they have the highest mortalities. And the presence of diabetes has been an important factor which has contributed significantly to the severity of to the increased severity of COVID-19 disease, and also to the higher mortality. Now, as we can see that COVID-19 disease, it causes because of the cytokine storm that we see in COVID-19, there is activation of the inflammatory cytokines, there is activation of the natural killer cells, the reactive oxygen species are oxygen molecules are produced in greater amounts, and there is activation of the RAS pathways with increased production of angiotensin II, and also the activation of the coagulation pathway. Through all these mechanisms, there is increased there is a increase in insulin resistance, vascular endothelial damage, and hypercoagulation, and ultimately leading to severe disease and morbidity and mortality. Now, if you look at the ACE2 pathway also, it is important to understand that because of the entry of virus into the cells and consumption of the ACE2, the conversion of angiotensin II to the Ang1 to 9 does not happen, and through this pathway being blocked, this is a pathway which has anti-inflammatory, anti-proliferative, and vasodilatory effects. So in view of the blockage of this pathway, most of the Ang2 goes towards the AT1 receptor and has more of the vasoconstrictive and the inflammatory and other pathways are activated. So this is how COVID-19 disease leads to problems. And now let us look at Ramadan fasting and COVID-19 disease. Whether fasting can be a predisposing factor to COVID-19 virus, does fasting impair the immune system, and does fasting reduce physical strength? So these are the three issues that I'll quickly discuss about, and then I'll go on to show some of the data from the Dar survey, which has again shown that fasting did not have a significant impact on the number of people who, the COVID-19 disease pandemic did not have a significant impact on the people who chose to fast during the month of Ramadan. So if you look at the nutritional aspects, we know that consumption of high calorie diet foods lead to obesity and subsequently chronic inflammatory state with low grade inflammation, and the consequence of this being increased prevalence of autoimmune disease like rheumatoid arthritis and inflammatory disease like insulin resistance and its various manifestations. And it has been shown in different studies that fasting has a significant benefit on both in healthy people and those with chronic disease. It leads to, whether you look at the different types of fast, whether you look at the keto diets or whether you look at the reduced meal frequency or the calorie restriction, most of the benefits has been seen with calorie restriction produced and also with the intermittent fasting, which has been reviewed very extensively, and it has been shown that these have a significant impact of increasing lifespan, improving the insulin sensitivity, reducing the oxidative stress and inflammation, as well as improving overall having a greater effect of reducing the morbidity and mortality due to cardiovascular disease. So fasting certainly has significant benefits, and as you can see, this cartoon shows all the benefits in different on different organ systems, right from a reduction of insulin resistance and improvement in reduction in the oxidative stress and IGF-1 levels, reduction in the cardiovascular benefits are listed out here, and then they have significant neurological benefits. So all these benefits do accrue from fasting, and the effects on the immune system also of fasting have been reviewed very elegantly in this recent review from Frontiers in Nutrition, which was published in January of last year, where it was very clearly the authors have shown the effect of various nutrients and the effect of exercise on the improvement of immunity, and they have highlighted the importance of exercise during the non-fasting hours and the adequate nutrition during that period, with adequate adequate carbohydrate intake and adequate intake of fruits and vegetables, which have a significant impact on improving the immunity. Now they have elegantly discussed about the types of exercises that can be advocated, which could have a significant benefit on the improving the immune functions. So Ramadan fasting does not lead to any immunological malfunction. On the contrary, there exists a considerable body of evidence that suggests that fasting can strengthen the immune system against infections. The immunoprotective effect in part may be attributed to increased serum levels of certain immunoglobulins such as IgA, and more recently it has been shown that the complement levels also are favorably influenced during the fasting. And there's also data showing that infections like tuberculosis can also be minimized in healthy individuals who undergo fasting. So it's important that good hygiene and appropriate nutrition are effective in terms of reducing the rates of COVID-19 infection, and are effective preventive approaches. Moderate exercise training and proper nutrition are the most important factors that can help in supporting the immune function. And it has been shown that while many individuals may have doubts, but it is clearly seen from all these studies that appropriate hygiene and proper nutrition could have a significant impact in reducing the risk of infection. Now, Ramadan in COVID pandemic, what is required? We require, it's very important that pre-Ramadan education is very important. Ramadan specific education is very important, and proper pre-Ramadan risk stratification is important in this during this period of pandemic. Ramadan specific education has a very important role to play. Although it has been seen that our diabetic patients have not been able to come back to us before the month of Ramadan for advice, and it is important that we use digital media to our digital tools that are available to us to partake this education and see that they have a safe fasting during the month of Ramadan. Maintenance of good hygiene and avoiding inspections, adequate hydration during the non-fasting hours is something which we have to emphasize to our patients, and proper diet and moderate physical activity and aerobic exercises are going to be helpful in improving the immune functions. And appropriate advice regarding adjustments in the medication dose and timings are important aspects that have to be addressed while we are preparing our patients for fasting during the COVID pandemic. Now, several organizations have given guidance on fasting during COVID, and they've highlighted the need for again pre-Ramadan assessment and proper hydration during the non-fasting hours. They've spoken about. The emphasis has been on educating the people older than 65 that they can refrain from fasting in case they have any medical problems, and but again ultimately the decision should be made by the patient himself along with his physician's advice. And the NHS also has given guidelines on what has to be done in case a person who gets infected during the Ramadan month and has COVID-19 disease during that period. What do they do with the fast? They have given clear guidelines on how they need to avoid fast, break the fast, or abstain from fasting during that period, ensure adequate hydration, and take up the medical advice. Now, Ramadan focused education is the most important part, which has been discussed in all the previous talks, where we have seen that that many of the participants in the Dar study also have had access to Ramadan specific education, but this was probably a factor which could not be achieved to the extent that we wanted in the previous 2 years because of the COVID pandemic, because of patients not being able to access the healthcare facilities, and it is therefore important that we address this issue and try to provide education in digital format to our patients. Now, quickly, let me just show you some aspects of the Dar Global Survey, which was conducted in 2020. I was also part of this, and we had a good number of patients from our side who also participated in the survey. And this survey, the survey was basically aimed to understand the characteristics and type of participants with a specific comparison of those between less than 65 and those more than 65, and also to study the impact of COVID on the decision of fasting, the intention to fast, and duration of Ramadan and Shawwal fasting, hypoglycemia and hypoglycemic events. So, if we look at the data from this, it is clearly seen that more than 85% of patients, or almost 87% of patients, went ahead with the fasting, and the COVID-19 pandemic probably caused a significant, probably had an influence on only about 6% of patients reconsidering or thinking about their decision to go ahead with the fast, while more than 90% of the patients did not consider COVID-19 pandemic as a major challenge in terms to go ahead with the fasting during the month of Ramadan. The duration of fasting also, majority of the patients could complete 30 days of fasting, and the mean duration was about 27 days of fasting, and with a significant number completing the 30 days of fasting. And very few patients, less than 12% of patients, needing to break the fast because of hypoglycemia or hypoglycemia related illnesses. And as we can see that there was a significant, as you can see, the HbA1c distribution, about almost one third of the patients had a good HbA1c of less than 7.5, one third of them had HbA1c more than 9% also, and a third of them were between 7.5 to 9, and they were on different types of medications, and including some of them who were also on insulin along with SUs, and they were at the highest risk of hypoglycemia. So if you look at the hypoglycemia and hyperglycemic events during Ramadan, we see that the incidence rates of hypoglycemia, particularly were in the range of about 15.6%, more in the patients who were more in those who were over the age of 65. Again, hyperglycemia was also experienced more in those hyperglycemic emergencies were experienced in 16% of the patients. Again, the distribution was almost similar, with more of hyperglycemic events being seen in younger individuals. And if you look at the key parameters in patients who fasted during this 2020 Ramadan, we find that 61.9% could fast for the entire duration of 30 days, 84.8% reported no symptoms of hypoglycemia, and 84.4% reported no symptoms of hyperglycemia also. And if you look at the individuals more than 65 years of age, the mean days of fasting was 27 days. 79% could fast without hypoglycemic events, and as you can see that this survey, probably this is the largest survey since the Dar study, and this has shown that a large number of people over the age of 25 could also fast safely during the 2020 Ramadan period. Concerns of fasting COVID-19 pandemic affecting the decision was only in a small percentage of individuals, particularly in those over the age of 65 had some concerns, while under the age of 65 a lesser number had any concern regarding the fasting during Ramadan. Over 83% of the participants fulfilling the Ramadan fasting, 94.8% fasting more than 15 days, and only 12.6% had to break the fast due to diabetes related illness. And hypoglycemia and hyperglycemia occurred in a small number of patients. This was and SMBG was performed in almost 73% of the participants, and 43% received Ramadan focused education. So I would like to summarize by saying that during the COVID-19 pandemic, universally high rates of fasting were observed regardless of the fasting risk level. Glycemic complications occurred frequently with older adults, requiring higher rates of acute hospital care as compared to the younger individuals. Risk stratification is therefore essential, followed by pre-Ramadan Ramadan focused education, and this should particularly focus on self-monitoring to reduce and prevent complication rates, with particular emphasis given to the older individuals. I would like to conclude by saying that Islam allows and indeed encourages the sick persons to eat and drink as needed when sick, and subsequently make up their fasting days when they are better and stronger. Emphasis should be given on the need to maintain social distancing measures during the month of Ramadan. Presence of the current COVID pandemic is not a contraindication to fasting in otherwise healthy individuals who are asymptomatic. Good hydration should be encouraged in the non-fasting hours. Thank you all.